Foraminotomy. Introduction. Spinal stenosis happens when the nerves in the back get compressed because of narrowing of the openings they go through. Select true or false. Correct. Your risk for spinal stenosis increases with age. Select true or false. Correct. Changes that happen in the spine as people get older are the most common cause of spinal stenosis. A spinal fusion, in which two or more bones in the spine are joined together, is always required during a foraminotomy. Select true or false. Correct. A spinal fusion will only be done if the spine needs to be stabilized. Are anesthesia-related complications common during and after this surgery? Select yes or no. Correct. Anesthesia is safe. But the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Are infections common after spine surgery? Select yes or no. Correct. Infections are rare. Though rare, infections, bleeding, and scarring may happen. Which one of the following is true about the foraminotomy operation? Choose one of the following options. 1. It is always successful. 2. It is usually successful. Correct. Although the operation tends to be successful, there is a possibility that it may fail to relieve the symptoms. Thank you for using Explain.